Hey guys, I'm Sarah Peacock and I'm on the Healthcare Committee with Petal XL by 5. I'm also a full-time registered nurse at the Children's Clinic with Hattiesburg Clinic, and today I just wanted to introduce to you guys Dr. Nicole Carden. She is our Petal pediatrician and she's going to be talking to you guys about safe sleep.
So this is what safe sleep looks like. There's a separate infant sleep space in the same room as their parents, on their back on a firm mattress with a tight-fitted sheet, with no bumpers, loose blankets, pillows, or toys, and not overdressed or overheated. So why does this matter? Well, unfortunately, every year there are thousands of cases in the United States of sudden infant death, some of which are explained and some of which are unexplained. Half of the cases of sudden unexpected death are due to SIDS. Examples of explainable causes of infant death include those in the sleep-related category. So what is SIDS? SIDS stands for Sudden Infant Death Syndrome. This is the sudden, unexpected, and unexplained death of an infant between the ages of 1 month and 1 year of age, and it is the leading cause of death in this age group. Most SIDS deaths occur between the ages of 1 month and 4 months of age. Sleep-related causes of infant death. These include suffocation, entrapment, and strangulation. I've listed here what each of them are. Suffocation is when an object covers the baby's face and nose, preventing their ability to breathe. Entrapment is when the baby becomes trapped between two objects, such as the wall and a mattress or bumper pads. And strangulation is when something wraps around the baby's face, neck, or chest. There is good news. We have come a long way in learning about SIDS risks, and the rate of SIDS has decreased by 60% since the early 1990s. This is mainly due to the Back to Sleep and Safe Sleep initiatives. So back to sleep. Infants who sleep on their backs are much less likely to die of SIDS than those who sleep on their stomachs or sides. This includes any time the infant is sleeping. Sleep surface is also important. Infants are safest when they are sleeping on a firm surface. Those who sleep under soft surfaces, under soft coverings, or have toys in their sleep area are at increased risk of SIDS. So what can we do to lower your infant's risk? There is no definite way to completely prevent SIDS. However, you can significantly decrease the risks to your infant of dying from SIDS. How can we do that? Always place your infant on their back to sleep. This includes for naps and at bedtime. Safest position for babies is on their back until the age of 1 year. Babies who usually sleep on their back but are then placed on their stomach for naps are at an even higher risk of SIDS. And an infant who rolls on their own during sleep is fine. You do not have to reposition that infant. You want to use a firm, flat sleep surface with a fitted sheet only. No other bedding or soft items in the sleep area, and never place an infant to sleep on a soft surface such as a couch or a pillow, as this can be very dangerous. Do not use a car seat, stroller, swing, or infant sling as a regular sleep space for your baby. A crib, bassinet, portable play area that follow the safety standards for the Consumer Product Safety Commission are recommended, and I've listed their website and their phone number below. Breastfeeding has many health benefits for both mother and baby. Babies who are breastfed are at lower risk for SIDS. The longer an infant is breastfed, the lower that risk becomes. If you do breastfeed your infant in bed, make sure to remove all bedding, soft items, and other things from the area before doing so. And once completed, put the baby back in their own separate sleep space. Sharing a room with your baby is highly recommended by the American Academy of Pediatrics for at least the first 6 months, but up to 1 year of age. This also significantly reduces the baby's risk for SIDS. Do not put objects such as toys, crib bumpers, or loose bedding under an infant, over an infant, or anywhere in the infant's sleep space. Keeping these items out of that space decreases the risk for SIDS and other sleep-related causes of infant death. Avoid smoking during pregnancy and do not allow smoking around your baby or in your baby's environment after the baby is born. Avoid drinking alcohol or using marijuana or other illegal drugs, and make sure to take care of yourself and get good prenatal care. Pacifiers. These have been shown to reduce the risk of SIDS for all babies, including those who are breastfeeding. Do not attach it to anything such as strings, clothing, stuffed toys, or blankets, as this can increase the risk for suffocation, choking, or strangulation. To avoid nipple confusion, the American Academy of Pediatrics, or the AAP, recommends waiting until your baby is breastfeeding well before introducing a pacifier. Do not force your baby to take this pacifier, and if it falls out during sleep, that's okay. You can leave it out. Do not let your infant overheat during sleep. Research has shown an increased risk for SIDS with too many layers on the baby and a higher temperature in the room. Do not overdress or overbundle the infant, and watch for signs of overheating, such as sweating on the skin or feeling warm to the touch, especially in their chest area. Keep the infant's face and head uncovered during sleep. Vaccines are very important. Studies have shown that vaccinated infants are at less risk for SIDS than unvaccinated infants. There are several products that are on the market these days that are purported to prevent or reduce the risk for SIDS. The evidence does not support the safety or effectiveness of any of these items, and those include wedges, positioners, or other products with this claim. In fact, many of these products can actually increase your infant's risk of SIDS if placed in their sleep environment. I would recommend that you speak to your pediatrician before getting any of these items. Heart and breathing monitors are also becoming increasingly popular. These may be recommended by your doctor for other reasons than SIDS or SIDS risk, but you should definitely speak to your pediatrician again on these items before purchasing them. Swaddling. There's no evidence that swaddling can reduce the risk of SIDS, and in fact, it too may increase your risk of SIDS and other sleep-related causes of infant death, especially if the baby is laid on their belly. Stop swaddling your infant when they start trying to roll over, and this is usually between 3 months and 4 months, but can be earlier. So if you see your infant starting to try to roll, don't swaddle your baby anymore. And remember, safe sleep looks like this. So a separate infant sleep space in the same room as their parents, on their back, on a firm mattress with a tight-fitted sheet, without bumpers, loose blankets, pillows, or toys, and not overdressed or overheated.